Dun 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 dun. Da 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 da. Hello and welcome back. This is episode 2 in the 4-part series. Episode 1, we talked about some things you can do to prepare before going into the backcountry. In this episode, we're going to talk about treatment for common injuries you may encounter. When riding in the backcountry, it's important to consider the most likely types of injuries you will encounter: road rash, puncture wounds, soft tissue injuries, bumps and bruises, joint injuries, sprains and strains, and head injuries or traumatic brain injuries, TBIs, and finally broken bones. For the purposes of this video, we will stick to relatively short backcountry riding in North America, where we won't be drinking unfiltered water from streams and ingesting Giardia or other parasites. If you're traveling overseas or across international borders, consider including anti-diarrheal medication, Pepto-Bismol, as well as things like mosquito repellent and mosquito netting, sunscreen, moleskin, and so on into your first aid kit. Not that you can't have those issues like diarrhea and mosquitoes in the United States, but typically our guts become accustomed to the type of environment that we live in day to day. When we go in and change that environment, that we can have gastrointestinal issues such as diarrhea. In the United States, we don't have a lot of malaria mosquitoes like they do in some other countries, so mosquito netting isn't as vital. Abrasions, also known as road rash. When you have an abrasion, you need to clean the area to the best of your ability. I would first flush the area very well with lots of clean water. Get as much of the debris out as possible. Then I would use a substance like iodine to clean the reddened wound bed area. During the cleaning process, you'll likely experience a lot of pain. This pain will pay dividends later on when you don't have to deal with an infection because you clean the wound bed so well, and decreases the amount of debris moving around in the wound bed, which can be painful. After I have the wound clean, I add a lot of triple antibiotic ointment. This has two purposes. One is to help prevent infection. The other is to help prevent gauze pads from sticking to the wound bed. There is a process called wound debridement where they would have gauze stick to, if I had an abrasion here, have gauze stick to that wound bed, and then they tear off the gauze, much like ripping off a Band-Aid, and take a lot of that tissue in the wound bed with the gauze. Don't really do that so much anymore. That healthy tissue that's forming there and helping to heal that wound also gets torn away when you rip off that gauze pad. So the triple antibiotic ointment helps to prevent the gauze pad from sticking and maintain that good tissue in that wound bed. After I have the abrasion cleaned and triple antibiotic ointment applied into the reddened area, then I put on a layer of gauze. The type of gauze I choose depends on the wound. If there isn't a lot of bleeding, if it's a relatively small area, I can use a gauze pad like this. I have many of these in my kit. Or if it is a larger wound and is bleeding quite a bit, I can use a Curlex roll or a gauze roll, and I can put that unrolled right on there, or I can take it out of the package and unroll it around the limb. Be careful it doesn't get too tight and cut off circulation from the wound down. Another point about gauze pads is that if this becomes saturated with blood, never remove it. Leave it on there and allow it to continue to work. There's clotting material that's soaked into that blood, and if you remove that, you're starting over with the clotting process. If this one becomes saturated, leave it on and add another one, and so on and so forth. Again, this is when it's nice to have a GPS device that you can communicate with emergency personnel. If you have a wound that you can't stop bleeding, they can help direct you. I would strongly discourage you from applying a tourniquet. Frequently, the tissue below the tourniquet will die and be lost. Now we're going to talk about bleeding. There's different types of bleeding, and the type and amount of blood guide your treatment. Obviously, the more blood, the greater the concern. Generally speaking, dark red blood is venous blood and it clots more easily. And generally speaking, bright red blood is arterial blood, and it's more difficult to stop because it has a pressure of the cardiovascular system, the heart and the vessels, pushing against it for your pulse. And that can be more difficult to stop and might require longer direct pressure on that wound to stop the bleeding. What I've often told patients and clients is that this amount of blood that just fits into the palm of your hand, not too concerning. The amount of blood that can fit into your cupped hands is extremely concerning, and that needs medical attention beyond what you can do yourself. For continuous bleeding, apply direct pressure and continuous pressure over the source of the bleeding and do not let up. Do not peek under the gauze. If I have a wound here and I peek under there to see if it's still bleeding, I'm disrupting that clot each time I move it, and the clotting process is having to start over again. Leave the bandage in place. If it starts becoming soaked and beyond the borders of the gauze, please apply another gauze or, like I said, t-shirt, whatever it takes to help soak up that blood and form that clot. If you have an arterial wound, say in a brachial artery here or radial artery here, it will likely be spurting, and that's going to take some significant effort to stop it. Again, it's when you need to get on your GPS communication device to speak with medical personnel about the proper steps to take to treat that bleed. Do not apply a tourniquet unless someone is going to die from blood loss and or you're directed to do so by a medical professional. Next, we're going to talk about broken bones and deformed limbs. Broken bones and dislocated joints can be extremely distressing and painful. I've had numerous broken bones and they are extremely painful. The pain and distress can make you lightheaded, nausea, unable to ride a motorcycle, or even walk or think clearly. One of my favorite YouTubers broke her wrist while operating a motorcycle in the backcountry and had to ride out quite a ways on rough roads before she could get help. And I believe, if I remember correctly, she encountered somebody that had an inReach and got help. The most important thing to do with a broken bone is immobilize it. Some cases require a sling or a splint, and others require staying put and waiting for rescue. The risks with moving or mobilizing a broken bone include increased pain, additional tissue damage, and increased risk of bleeding. For the sake of demonstration, we'll pretend that these two pieces of PVC pipe are a broken bone. And the edges are doing this. Frequently, arteries run next to the bone. They're deep, and veins run closer to the skin. If this breaks and is moving, because we're walking out, we're continuing to ride a motorcycle, we're trying to walk, whatever, if this moves, it can damage that artery, along with the other surrounding tissues. That damage can lead to bleeding under the skin that we won't see and be extremely painful. This is why, even if the bone is broken like this, laying on top, like my right clavicle is, you have to remain still so that these aren't moving around doing more tissue damage. A myth I've heard many times is that you cannot move an appendage below the area of a break. While this may be true in some cases, it's definitely not true in all cases. When I fractured this clavicle, I could move my arm. I had limited range of motion and I had a lot of pain, but I could still move this arm and hand. When I broke this wrist, I could still move this hand. The movement or lack of movement does not mean a bone is broken or not. Call for help if you're unable to self-evacuate. Stay hydrated and use ibuprofen as prescribed. to treat the pain, and practice applying splints and slings at home before you need to do it in the field. I'll have a future episode about slings and splints. Stay tuned for that. I'll also have a future episode about assessing pulses. This video, I'm not going to get too far into it. But again, if we have an injury or a break or something here and we're having to apply a splint or a bandage, I want to check this pulse before and after I apply that bandage or apply that splint. If this pulse changes, becomes less, non-existent, changes in any way, or the color of the hand changes, it goes white, blue, becomes swollen, cold, loses the feeling in it, this is too tight and needs to be released, allow the circulation back into the hand, and then redress, but more loosely. There are indeed times when doing the wrong thing can cause more harm than good. And wrapping a wound or a splint so tight that you cut off the blood supply and lose a pulse would be one of those times. It's very important to maintain blood flow below the site of injury. Again, unless you're applying a tourniquet as directed by a healthcare professional to save someone's life. There are multiple resources available for this online in your library, and I really, like I've said before, strongly suggest that you take an EMT course to really get the best training possible. Know the steps to treat injuries before you encounter them. Now I'm going to talk briefly about traumatic brain injuries and head injuries. I've had 5 concussions and they're nothing to be trifled with. Head injuries are frequently underdiagnosed, misdiagnosed. Symptoms of a concussion include, but are not limited to, headache, dizziness, drowsiness, nausea and vomiting, confusion, difficulty walking, slurred speech, memory loss, poor concentration, irrational behavior, aggressive behavior, seizures, numbness or paralysis to any part of the body. But if someone hits their head and experiences any of these symptoms, they need to seek medical attention immediately. This is not something that can be handled out in the field. This needs to be dealt with in a hospital setting. The skull obviously does not move, but the brain is swelling inside of that area. And the longer that swelling is allowed to continue in that closed space without an intervention, the greater the risk of permanent injury. Another thing about head injuries, if you significantly hit your head, do not take aspirin or ibuprofen. If there's a possibility that you're bleeding inside your skull, you do not want to exacerbate that bleeding. Ibuprofen and aspirin both inhibit clotting, so this is one of the few times that I would recommend Tylenol or acetaminophen instead of aspirin or ibuprofen. A traumatic brain injury will significantly impair the decision-making ability of the person who is injured. It is comparable to a friend who has had way too much to drink but believes they can still drive. Do not let them operate a motorcycle. If somebody smacks their head hard enough and is acting irrationally or has any of the symptoms that we talked about earlier, do not let them operate a motorcycle. This will only make matters worse. They may protest, they may say, I can ride, I'm good, I'm fine. I just puked that one time, I feel a lot better now. The thing with a closed head injury or traumatic brain injury is that can swell over time. So while they may feel okay now, as that swelling increases, they're going to be more and more inhibited. And to be on a highway, on a backcountry trail, anywhere on a motorcycle, while that brain is swelling inside the skull, is never a good idea. On that cheery note, I'm going to wrap this episode up. The next episode, we're going to talk about the individual items that I carry inside my first aid kit. Again, if somebody would benefit from this, please share the video with them. Please like and subscribe if you got something out of this. And if you have questions or comments, please leave them in the comment box and I'll get back to you as soon as possible. For the sake of demonstration, we'll pretend that these 2 pieces of PVC As a demonstration, we'll pretend that these two pieces of PV site